Brain bleeding after hitting head. If you sustain a head injury, you must take it extremely seriously. Often after the initial pain and shock, you might experience no symptoms or very mild ones, such as dizziness and nausea. It's easy to assume that no serious damage was done, and you can just continue with life as normal. However, the truth is, you might have sustained a brain injury that could turn out to be life-threatening. In this video, we examine what to expect after a head injury and when you need to seek urgent medical attention. What are common symptoms of a head injury? The symptoms of a head trauma can range from none at all to complete loss of consciousness or a coma. What's more, the symptoms may not occur immediately after the time of your injury. It may take quite a while for enough swelling or bleeding to build up in the brain to cause symptoms that you can recognize. Common symptoms after a head trauma include vomiting, difficulty tolerating bright lights, leaking fluid from the ear or nose, speech difficulty, paralysis, difficulty swallowing, and numbness in the body. Other milder symptoms include nausea, dizziness, irritability, and difficulty concentrating and thinking clearly. As we have said already, the number and type of symptoms you experience may not reflect the severity of the brain injury, so please do not assume all is well if you only experience mild symptoms. When should I seek medical attention? Let's start with the obvious scenario. If a person who has sustained a head injury is unconscious or not fully awake following the head trauma, then emergency medical services need to be called immediately. Time is of the essence in this situation, and quick medical intervention can mean the difference between life and death. Because head injuries are often associated with neck injuries, the victim should not be moved unless they are in immediate danger. Where possible, wait for trained medical personnel to help with moving the patient. If the victim is awake and feeling normal, it is worth seeking medical care if there was a significant trauma. Even though patients may have suffered what they think is a minor head injury or concussion, there is still a chance that the impact could lead to a brain bleed. If this is left untreated, it could have devastating consequences on the victim's life. A doctor will admit the patient to hospital for observation and a computerized tomography scan of the head to look for bleeding. Lastly, if you feel the trauma was mild, or if you experience no symptoms after the event, it might still be worth consulting your general practitioner, who is better placed to assess whether you need a CT scan. The GP will conduct a neurological exam and check the skull for signs of trauma, including bruising, contusion, and swelling hematoma. They may also check for a basilar skull fracture by looking for bruising around the eyes or behind the ear. So the bottom line is to seek medical attention if you have any concerns about the impact of the injury. It's always better to be safe than sorry. How are brain injuries treated? Minor head injuries, known as concussions, may require nothing more than observation and symptom control with pain medication. However, bleeding, or intracerebral bleeding as it's known, is a medical emergency and most likely requires neurosurgical intervention. The main surgery option is a craniotomy, where a hole is drilled into the skull and part of the skull bone is removed to drain the blood clot and thereby relieve pressure on brain tissue. Patients with significant amounts of bleeding in their brain are often in a coma. These patients require intubation to help control breathing and protect them from vomiting. Medications are then given to control the swelling in the brain. How can head injuries be prevented? In sporting activities, the use of a helmet decreases the risk of brain injury. Also, wearing a helmet while riding a motorcycle or bicycle significantly reduces the risk of brain trauma. Likewise, seatbelts will help prevent a head injury during a crash in a motor vehicle. Alcohol is often a factor in falls and other head injuries, so it should be used responsibly. Falls are also a concern among the elderly. Homes can be made safer by installing handrails on walls and in bathrooms. Canes and walkers are helpful as assistive devices to prevent falls. If you liked this video, please subscribe to Better Days, where we deliver fun and informative videos that help you become the best version of you. Till next time, have a great day.